Hi, all. My name is Caleb Smith. I use any pronouns, and I am the Director of LGBTQI+ policy here at the Center for American Progress. For today's event, captioning will be available at the bottom of your screen. You'll also find Q&A at the bottom of your screen. For any questions you might have, you can put them in the Q&A chat. We will be taking questions at the end of the event, and a recording of the event will be available at the conclusion on the CAP website. Finally, you can check the Zoom chat for reminders and links to policy products. Thank you so much for joining us today for the launch of the Transgender Veterans Toolkit, helmed by our partners out in national security. The Transgender Veterans Toolkit provides clear steps, policies, and guides to support the thousands of newly discharged transgender service members. It outlines advice on topics including healthcare access, housing, and more. Transgender people have a long history of serving honorably in our military. In fact, research, including CAP's 2024 LGBTQ+ community survey, show that transgender and intersex people serve at higher rates compared to their cisgender and non-intersex peers. Transgender service members of our military have proven themselves to be dedicated to service and to protecting our country. Despite this, transgender people are being targeted and barred from service. The president has released an executive order claiming that transgender people are unfit to serve. The VA later announced it would no longer cover transgender medical care for new patients, despite the fact that this care is life-saving and cost-effective. It is clear that the point of these anti-trans efforts are not to bolster our national security or to save money, but to score cheap political wins at the cost of our military families and our national defense. These anti-trans policies, rhetoric, and attacks that our community are experiencing is overwhelming. Pushing back can feel futile against such an onslaught, but this overwhelm is intentional. Anti-trans advocates and politicians are hoping to put us on the back foot, crossing their fingers that we will freeze or flee instead of fight. Our transgender service members and veterans, though, know exactly what it means to fight, even when we are overwhelmed or fearful. And it is from them that we can learn how to keep moving forward through this moment. It is crucial that we use this time wisely to lean into community and to support each other. We also must refuse to be shocked into permanent inaction. That too is why this toolkit is so important. It provides clear and concrete steps that we can take to ensure that every veteran can access the benefits and care that they have more than earned. No one should have to choose between serving their country and living as themselves. Just as those who have served, have protected, and provided for us, it is imperative that they too are given every opportunity to be healthy and to thrive. Thank you again, everyone, for joining us today and for continuing to show up for our trans community, for our service members, and for our veterans, and for the ongoing work to protect all of our rights. Thank you, too, to our panelists who are with us today. We're so appreciative of all of your time and efforts. I will hand it off now to the CEO of Out in National Security, Luke Schlesinger.
Hey, Caleb, thank you so much. It's great to be here with you, and we're so grateful for the support of the Center for American Progress in hosting today's event and with this great audience. This toolkit is a great opportunity for states to strengthen veteran care, benefits, and dignity, especially at a time when all those are under pressure. And the unique focus on healthcare, employment, and housing ensures lives, livelihoods, and care will continue. And most importantly, this is not only about transgender veterans, it's about building a system that works for every veteran. I am thrilled now to introduce our panelists, Kayla Williams, who is an advisor to Out in National Security. She's the former Assistant Secretary of Veterans Affairs for Public and Intergovernmental Affairs. And Lindsay Church, Executive Director and founder of Minority Veterans of America. Folks, why don't we start with a very simple opening question? Why this toolkit, why now, and what are the problems that it solves for states?
Sure. Thanks first so much, Luke, for inviting us to join you today. And thanks so much to CAP for hosting. It's really great to be able to have this really important conversation, and so glad to the audience for showing up for our transgender veteran brothers and sisters in this important moment. First, to introduce myself a little bit more, I'm Kayla Williams. I am myself an Army veteran, and in addition to formerly running VA's Office of Public and Intergovernmental Affairs, I also formerly ran their Center for Women Veterans, also previously ran the Military Veterans and Society program at CNAS, and worked at another think tank, and have tried to focus my research portfolio on the life cycle of those who serve. So in terms of why this toolkit and why now, and what problem we are aiming for it to solve for states, in this moment, as Cal mentioned, we are on the verge of having thousands of trans service members become trans veterans, with, as far as I know, still no real understanding of exactly when that's going to happen. We think it is somewhat likely that they won't be given the full opportunity to go through the complete transition assistance program as required by law in typical circumstances. But given how things are going, they're all in a holding pattern and then may be suddenly processed out of the military. And without having the full amount of time to prepare for that transition from military to veteran status, they may be suddenly unemployed, but without having had the opportunity to plan for successful post-military employment, to set up where they're going to be living, to set up how they're going to move into new employment that offers them health insurance. All of this could just happen on such short notice that we could have thousands of folks around the country who suddenly are trying to figure out how to rebuild their lives in what we all know has been a challenging time for most of us, with the economy and the uncertainty and instability happening due to other federal moves. So this toolkit is designed to give states some actionable policy changes that they can make independent of the federal government, and without having to pass new laws. These are relatively small ball activities that they can do to ease that transition when the moment comes and trans service members become trans veterans. They can get these steps in place so that when that moment comes, they're able to immediately step up and support these service members when they become veterans. I know that there are a ton of states who are actively looking for ways to attract veterans to live in their states or commonwealths. I live in a commonwealth, because they know that we contribute so much to the economy, to our local communities. We volunteer at high rates. We're more likely to vote. We bring so many assets to our local communities. And these trans service members are going to be tremendous assets wherever they land as well. They've shown by their service that they are able to endure really difficult circumstances. They're highly trained with incredible skills. And we want to empower states to have policies in place to retain them in their states, when we see a lot of states right now who are actively looking to add to their base of potential employees. So have these tools in place and be able to support those folks in moving into the economy and contributing to their community in new ways, but without having to try to figure out what complicated sets of legislation to pass or wait for the federal government to do anything. You can take these regulatory and policy changes and put them into place right away.
Thank you, Kayla. Lindsay, I'd love to bring you into this since you run a veteran service org.
Yeah, thanks for having me. I'm Lindsay Church. I'm used they, them pronouns. I'm the Executive Director of Minority Veterans of America. I'm also a trans non-binary veteran of the United States Navy. Really glad to be here today. As my resume is not nearly as impressive as Kayla's, but I'm super glad to be here and to be a part of this conversation. For anybody who doesn't know what Minority Vets is, we're a small organization, nonprofit dedicated to creating belonging and advancing equity for minority veterans. We're largely headquartered out of Washington State, where I am in Seattle right now, but we do work all around the country, working on housing, homelessness, building community belonging, community centers, and doing a lot of financial assistance to people which I'm sure nobody is going to be surprised that we have seen an increase in requests for our services. We've given out over $100,000 in financial assistance already this year. And these are two minority veterans who are already struggling and living in the margins long before any of this started. And so I am glad to be on this call and to be a part of this toolkit launch, and recognizing that this is one of the hardest moments in time that most people have lived through, just generally speaking. But as a trans person in 2025, it is the scariest time to have to figure out most of the things that Kayla was talking about, whether you're transitioning out of service or you're already a user of the Department of Veterans Affairs. As I use the Department of Veterans Affairs, actions of the Department of Veterans Affairs have really drastically changed over the last year and made it so that many of us don't want to pursue using that type of healthcare services. And so there's a lot of things that are on the landscape for trans service members and veterans that states themselves can do to mitigate some of the outcomes, because we knew long before this that trans people that are part of the military and veteran community were already more likely to die by suicide, more likely to have suicidal ideations, unique traumas from military service, unique traumas from after service. And so what states can do is provide a backstop to the services that veterans can no longer receive from the Department of Veterans Affairs, whether it be because it's regulatorily barred, and that's probably not a word, I apologize, but barred by regulation and policy, or that it is no longer safe for people to use that service. So I'm really excited for the idea that states can pick up these policies, whether it be state lawmakers themselves or veterans who want to do state level advocacy. Because that's one thing that I see one of the biggest gaps in our community is that we all pick up the sword on veterans policy when it comes to the national policy. That's great. We know that that's important. It's also really not working well right now. And we have to really get smart about how are we going to provide as much of a safety net as we can right now, because we know the safety net is falling apart. And what we used to be able to do is hold that safety net all together in the policy land, and we can't do that now. So we have to be thinking about what are the state level things that can mirror or mimic or replace some of those things until we can get the federal government back to a place where people can trust it and use it for services. And so state policymakers, advocates can use it themselves. And so really being able to see what are the policy things that I should be chasing and trying to advance at the state level, because it's much easier for me and my friends to go hit the hill here in Springfield, and I live in Illinois, than it is for me to, go to Capitol Hill and navigate whatever treacherous, fights are happening up there. So all of that to say, put a sword in veterans' hands and see what happens. Point them towards a target, and oftentimes they're really good at advancing, whatever it is when it comes to, disparities. And so I think it's a really great opportunity for people to pick up the sword.
Thank you. That's very helpful. And I want to come back and talk more about state level advocacy work, since you've done so much of that. But since you guys have been, long tenured in the veterans policy space, I'd love to hear from both of you a little bit about how focusing on transgender veterans improves the outcomes and efficiencies for all the veterans in the community. Kayla, would you like to start?
Sure, absolutely. So we know from other arenas that when you try to help those who have disproportionate challenges, it ends up helping everyone. So, a really well-known example would be adding cutouts on sidewalks for wheelchairs that then makes it easier for folks pushing baby carriages or dragging their groceries in wheelie carts to also move freely through the streets. When I worked at VA and we were able to get more changing tables put into bathrooms, that disproportionately helped women veterans because women are more likely still to be the primary caregivers for small children. But we found that those weren't just being used by women, that there were grandpas who were caring for grandchildren who would come in and couldn't find childcare and bring their grandchildren with them that use those changing tables. So again, you put something in place that's designed to help folks who are carrying a heavier burden. It ends up helping others in the community as well. So some of the policy changes that you recommend in this fantastic toolkit, like easing licensure requirements for transitioning service members, that will help trans veterans as they move out of the military. That's going to help all veterans who are facing challenges of getting licensed in a civilian sector with their military background.
Yeah, that makes sense. Licensure is one of those things that I've been working on since I think 2011 or 2012. It's very challenging, but very important. Lindsay, turning to you here, I'd love to hear your thoughts as well, based on your experience as a VA user, but also as an advocate.
I'm going to reframe your question a little bit, and I'm going to go take it from how not focusing on transgender veterans will diminish the outcomes of inefficiencies for all veterans. One of the things that I think about is some of the new policies around VAs. There's a directive called 1341, which kind of backstopped all of VA's healthcare provisions, what was required, what was not required, how to, look at the, clinical guidance, things like actions for using appropriate names, pronouns, things like that. When they changed policy, they didn't do it legally, so they didn't do it in Congress. They just rescinded said memo and said it could not be changed or altered to be in compliance with the executive order of defending women. So they said, we actually can't do anything with this. We're just going to rescind it outright. Now, what that's caused is absolute chaos, wreaking havoc across the agency, because you'll look into different portions of policy within VA and it says, look to VA Directive 1341. Well, if 1341 no longer exists, then it no longer means that somebody has to have said access to anything ranging from cryopreservation and advance of gender affirming care, which is no longer covered because 1341 was rescinded. 2, cisgender people actually having harder time accessing some of the care because of these said policies have been rescinded. We've heard of cisgender women who need testosterone to live. Guess what? Women have testosterone, and it means that they actually need it in order to live. There have been instances where women have tried to access their regular hormone treatment of testosterone and been denied because it's cross-sex hormones. Well, guess what? That's just what the VA current administration has said, that all of this, if something that is not, women get estrogen, men get testosterone, and women asking for testosterone, we're going to put a block there. Well, that becomes a problem for a woman who needs access to testosterone just to live. Same thing with men with breast cancer. We just saw this come out that men with breast cancer, it's no longer considered breast cancer for men is no longer considered part of the reproductive system, and therefore they don't have to cover it in the same way, and they don't have to care for it in the same way, because the defending women EO, the biological truth EO, said that men's reproductive system does not include breasts. Well, guess what? Men do get breast cancer because they do have breast tissue, as it turns out, and it actually could kill them. And now men who have breast cancer have to figure out how they're going to access care and if it's going to be considered as part of service connection because they were exposed to toxins, and the PACT Act should cover this. We're going to continue to see this over and over and over again. We are less than a year into all of this. We will continue to see the complete unraveling of what we have done to ensure that equitable care happens for all veterans, not just trans veterans, but to Kayla's point earlier, when you take a community that you have to look at it a unique way, you have to pull communities together to talk about what's happening, you build specific policy with that in mind. When you create tailored interventions, they actually increase outcomes, improve outcomes for all. But when we say this community does not deserve it because they're not worthy, they're not, truthful, they don't even exist, it creates this problem that we then have to unroll. So we actually do focus on the problems and challenges that trans veterans are experiencing within the VA and look to solve some of those, we can advance policy. But if we don't say, if we say we don't want to focus on that, we don't want to think about that, we're going to continue to see these changes impact all veterans and not just people like me that they're targeting.
Yeah, no, that's very helpful and an important contrast to what Kayla was saying about sort of the way in which this could lift care for everyone. Since we are discussing healthcare, Lindsay, I'd love to bring you in and have you chat a little bit about the healthcare pillar and talk about, your experience as an advocate, but also what you think these gaps fill and, where there's still room for improvement.
I think from the federal perspective, I think obviously we've lost almost everything, really. Like when it comes to trans veterans, we barely have any access to anything. If you were receiving hormone treatments before, you could go to VA and you can still receive those. If you weren't receiving hormone treatments as of March 25th, you're no longer from here until this policy changes to access that. When you think about what states can do, I think of Washington State as an example, right? So we work within Washington State. We have veterans here. There's about 106,000 veterans that are in the county that we exist in. Here in King County, we have an unmet care needs fund here. And that is VA providers came together and said, I would like to give you funds because we can't provide this care to subset or offset some of the costs from that. we created this gender affirming care fund. It's a very small fund. We then move people to financial assistance and use a larger bucket of money. We have created, clinical partnerships with the local clinic here that does all of the intakes, the assessments, the referrals, and the medication prescriptions. We pay for the prescription. We keep them on for as long as we can. Then our goal is to get them to state level Medicare. When we go to state level Medicare, you have a comprehensive gender affirming care plan, hormones, voice treatments, prosthetics, surgery. It has more than VA to begin with. Now, the problem becomes, to Kayla's point earlier, I think we talked earlier before the session, is that many people that use VA for care can no longer access ACA or state level Medicare because they have VA provided medical care. So they are actually completely opted out of state level Medicare. What states can do is try to make it so that veterans who are using VA, who have discriminatory policies that are no longer able to access that, can apply for some type of exception. We've seen this in a lot of different places in different states, especially related to veterans, where the state creates an exception to policy that would be set aside for a specific community. And so my suggestion is really to pursue, how do we get more veterans opted into state level Medicare programs, because many states do have gender affirming care. So that to me is like one of the greatest things, I think, for backstopping some of the things that we've seen rescinded already. We can't do it in every state, obviously, but there are many states that have already undertaken adding gender affirming care to their state level Medicare programs. So it is making an exception to policy. Whatever that looks like for each state, it's going to be a little bit different. Some people don't have to do much legislatively, some people do. And so what that looks like to undertake as a state, but ultimately, veterans are going to need a secondary place to go. And it's going to need to be more than just, you can go to MBA for the small community care fund, because there are going to be thousands and we can only do so much within the one county. So how do we create an expansion? And that comes from state, county, and local governments coming up with funds to be able to create some of these programs or replicate some of these programs in this moment, because it's not just the right thing to do, but it's going to save lives. When you think about how many people that healthcare is a determining factor for employment, housing, family stability, like there's a number of things, social determinants that are important when it comes to whether or not somebody can access healthcare. So really, truly focusing, I'm a big fan of like healthcare. There's some people that do housing first, that do healthcare first, or housing and healthcare first, but truly recognizing, we have veterans across the country experiencing many things. I have a veteran that was just living in their car that is experiencing some extreme health concerns, and has been living in one of our homes for like a couple of months, and her health has already improved and increased. And so she's actually far more stable now today. But that's just one person that can help.
Yeah, no, it's always important to have, personal illustrations of policy impacts, especially right now when so much policy is being pulled back or taken away from people who've served the country. Kayla, I'd love your perspective on the healthcare pillar in terms of, your experiences, but also, as a researcher and as a policymaker, and sort of whatever other thoughts you'd like to share.
I think another important element of the toolkit is to encourage states to look at what they can do in terms of state licensing boards to hold firm on the pre-2025 federal standards of care, to make sure that they're aligned with the WPATH standards of care. Even if we see the federal government making these changes to be actively discriminatory, what can you do at the state level to hold firm? And what can you do to ensure that providers within your state are also getting the education that they need through continuing education units and so forth to provide culturally competent and evidence-based care? There are some states, including Virginia, that have peer support specialists for veterans here in the Commonwealth, and to encourage those peer support counselors to take training offered free online in how to provide culturally competent care, to make sure that they understand how to best provide care for LGBTQIA plus veterans. I know Lindsay has done some great online training with PsychArmor that's available free, that providers can take. So exploring what is out there to get providers at all levels in your state to be aware of training that is free and accessible, and then at the state level to put requirements in place to follow evidence-based standards of care.
Yeah, that's very helpful. And I hope folks listening on the call will visit the toolkit website and take this and raise it with their state and local government. Lindsay, you were talking about the importance of housing as part of solving a variety of veterans policy issues. And since the toolkit has a housing pillar, I would really appreciate both, your perspective as someone who's, running a community housing project through county funding in Washington State, but also in terms of how we can improve housing outcomes for trans veterans.
Yeah, I think prior to 2025, trans veteran housing was already sketchy at best. Thinking about what was available, there's not a lot that's available when it comes to housing and dedicated beds in any county to transgender veterans. It was Luke was saying we operate the only LGBTQ transitional housing unit in the country for veterans in Washington State. We have 5 beds. That's it. And as far as I know, there are not set aside beds. There are women veteran beds here in King County. There are 2, and they're in places that people don't want to go. As of earlier this year, VA's paperwork has all been adjusted. So sex assigned at birth is what they collect. It's not gender identity. You are now placed into housing based off of your sex assigned at birth, which if you understand anything about housing and transitional housing, shelter situations for trans women are generally not safe, because if you put people into housing that aligns with their sex assigned at birth, you're introducing extreme risk for sexual violence, for violence in general, and for higher rates of really bad outcomes. What we're hearing more of is that people are choosing unsheltered housing or living in their vehicles because it's easier and safer than it is for them to go to any of the services that would otherwise be VA funded. Many of the networks, even here, that are not specifically VA funded, are offered by Catholic community services. Many trans people don't feel safe using religious-based services. So what you see across the landscape is, yes, there are services for veterans experiencing housing insecurity, but what you see actually is that there is nothing available that's tailored or available to people based on their gender identity and not their sex assigned at birth. So states really have to take a serious look at this. What are your policies? What is state level policy for anything that's operated or funded by the state? We exist in Washington State, in King County, by a property tax levy. And so we have a property tax levy that funds many millions of dollars worth of veteran programming here in Washington State, but it doesn't touch federal dollars. So therefore, the county has gotten innovative to make sure that the programs that would otherwise be targeted by federal government are covered by property tax levy, and there's no federal pass-through. So you're making sure that organizations stay safe while still continuing to provide the housing. In this moment, this is a really great opportunity for supportive localities to be looking at public-private partnerships to expand the access to transitional housing for trans veterans, and it needs to be single occupancy. It cannot be congregate housing shelter or housing environments, because they're not conducive to healing. What I see more often than not is just this model that only focuses on how many people in, how many people out, how many people in, how many people out. There's a point in the middle on transitional housing that we try to catch people and to keep them with us for over a year so that they have an opportunity to not just be stably housed, but heal. Programs associated with healing, because one of the things that I'm watching right now as a don't ask, don't tell survivor is all of these trans people are getting kicked out of the military. All they can focus on is immediate needs. They're never going to unpack the healing and pain that exists in this current moment, and all of these outcomes are going to be very hard to navigate. Kayla and I both served under don't ask, don't tell. I still have scars that I'm unpacking from service, and I got out of the military in 2012. I think about what's happening right now. What's going to happen to the trans service members who are being pushed out in such a cruel and unethical way. What's going to happen to our community is, yes, we have to deal with the immediate needs. We have to figure out what does the healing model look like, and how can states and localities really focus on that, and eventually the federal government using innovation funds through like the Department of Veterans Affairs that used to do innovation grants to work towards this type of these types of services. But ultimately, I hate to tell everybody that the access to housing for trans-specific housing for veterans is not great. We're in a really bad and scary moment where much of our community will continue to choose unsheltered homelessness, living in their vehicles, living in parking lots, doing whatever they have to just get by, because where they're telling people to go is not safe.
That's grim, but that's very helpful. Kayla, do you have stuff you want to add to? Yeah, I know you've looked at veterans housing before.
A couple things that I'll mention. One is that if your state still does not have gender identity as listed as a protected class, then I think that's something that can also be looked at. It should be illegal to discriminate against trans people in housing. So that is something that I would encourage folks to ask their state legislatures to take up if that has not been addressed at the state level where you live yet. Another thing to consider is I 100% agree with everything that Lindsay said when it comes specifically to housing for single individuals. And also, we should think hard about the fact that not everyone moves into a position of homelessness or housing instability as a single individual. This can be a family problem, and trying to ensure that there is adequate housing to support families who are experiencing housing instability, homelessness, and thinking expansively about what family can mean. Some of the research that I was doing on women veterans in Pennsylvania, what came up that really struck me, we've heard for a long time there's inadequate housing for women veterans. Too many of the single room occupancy programs are the GPD is grant per diem programs. It's just men's housing available in so many places. Obviously, that's not necessarily safe or even possible in some locations for women. Women are more likely to be caregiving small children. So we've known for a long time we need more housing that allows women with families, people with families. But what came up that really surprised me were folks who were looking for housing that could also accommodate their adult children, because we had multi-generational families that are unfortunately falling into homelessness. And traditional programs are looking at, if you're talking about somebody with kids, you're talking about little kids. But given how things have gone, if you have, somebody my age or older with an adult child living at home falling into homelessness, are you going to force people to choose like who gets help, who gets support from a program? So thinking more expansively about what does family mean and how can we ensure that families get support and don't fall into homelessness is another way to kind of approach this in a way that could address some of the safety issues that Lindsay raised as well.
And Luke, before we go on, I think
Sorry, go ahead.
Sorry. I was just going to say, Kayla, you saying GPD brought something up for me. I think one of the things I would encourage people to think about is what are a lot of veteran housing is funded by VA through different programs. And most veteran housing in the counties are usually funded by that. There need to be new funding streams that we think about. And, we here in the county, they have a property tax levy and a veteran seniors and human services levy that funds all of the services here in the county, which means we have better services than almost anybody here. We have a huge housing problem, but I'll get for a minute another day. But there have to be other programs that are not VA funded that we have to start thinking through. What are other models that states can adopt that would allow for them to create their own housing programs, projects that work in the margins? Right now, we're watching the VA landscape. If you do things a certain way, if you ask for race, gender, sexual orientation, you can't receive VA funding. Like it's literally just cutting out all of these people. So what states can do is get innovative about how do we fund projects that will meet these barriers, because we know that they exist and they're only going to get worse. And if we don't deal with them, all our cities' problems are going to get worse. So how really challenging states to get innovative about how do we fund it without any federal pass-throughs to make sure that organizations don't touch federal dollars, to make sure that they can, buy and renovate or look at the landscape of what already exists within the counties or federal government or state governments. They've got all these buildings and all of these things that you can repurpose or maybe use less money to be able to do it.
Yeah,
that's build on that. I'm sorry, Luke, to step on you, but
oh, you're fine. You're fine. Go for it.
Another issue that we've seen come up in the past that Lindsay, I think what you're talking about speaks to as well. A lot of states in my research mimic their eligibility for benefits on VA's eligibility for benefits, which means that folks with bad papers are less likely to be eligible for benefits at the state level. And we know that under Don't Ask, Don't Tell, folks were being kicked out with bad papers. We don't yet know if that's going to be an issue again. with these upcoming potential discharges, but taking a look and thinking hard about what is the problem that you want to solve. And if the problem is to support those who have been harmed, then think very carefully about whether you want to mimic and replicate these federal standards about bad papers, especially when you kind of dig in there and crunch the numbers and look at how many more folks have been pushed out with bad papers since 9/11 compared to in previous eras. And, is this the type of thing when we know folks have sustained brain injuries at high rates in these conflicts, are developing PTSD at high rates due to these conflicts, have experienced sexual trauma, and may be, going AWOL to avoid their attacker, maybe turning to drugs and alcohol to avoid emotional pain from being sexually assaulted? Is that something that we want to let chase somebody for the rest of their lives, or can we be more expansive in thinking about who can we serve and how can we serve and support those people?
No, that's an excellent point. I think we are getting close to question time, so folks, get your questions into the chat. But before we do, since you guys have both done state and federal advocacy, I think it'd be great if you guys could share one or two either success stories or lessons learned from engaging and advocating for women and minority veterans across the country. However you want to attack that question.
Oh, come on. All right. I'll let Kayla go ahead. You came up, right? Yeah, go ahead.
Okay. So I'll use an example that sticks out to me because it was the moment that I realized for the first time that my voice could be meaningful. And I alluded to this earlier, but the first time I ever testified before the House and Senate VA committees, one of the things that I brought up was changing tables in VA bathrooms, and conveyed stories from friends of mine talking about how they had to change their baby's diapers on the floor of bathrooms in a hospital. And later I ended up speaking at an event for women veteran program managers from all over the country. And when I finished speaking, one of them came up to me and said, "Hey, I want to talk to you. I have to tell you that I'm at this particular VA medical center in Florida. We'd been trying to get our medical center director to put changing tables in bathrooms for years, and he would not listen to us. He would not listen to us, and we couldn't get him to make any progress on this. He watched your testimony live streamed, and now we have changing tables in our bathrooms. And thank you for raising that, and thank you for helping us get that done." And it was this moment when I went, there are now physical objects where there didn't used to be physical objects, because I ran off at the mouth. And that was the most validating moment for me to say, I can make a difference in this world. And I am, as you know, Luke, a huge nerd. But the other thing that it drove home to me is that what connects with most people, to my dismay, it's not charts and graphs and data and facts, it's story. And so everyone who is out there listening to this, you have a story that can connect with a policymaker. Have the data, have the facts, have the toolkit with all the actionable, implementable policy and regulatory things that you can tackle, but go and connect with those policy makers or legislators with that personal anecdote, that story that they can connect with human being to human being and say, "Oh God, that's terrible. Nobody should have to live through that. Nobody should have to go through that. Now I want to work with you to put that evidence-based policy change into place."
Fantastic. Over to you, Lindsay.
Okay, so I'm the good and bad news. The bad news is that being right won't win. Simply being correct and simply being right in this era will not win the fight. The good news is that there's an argument for everything. In the 10, almost 15 years I've been doing, actually 20 years I've been doing gender-based advocacy, I've realized that not everybody cares if it's right or wrong. Some people will fight you about everything, and that you have to have an argument for everything. So I've seen a lot of people on this call. I've seen some people who are state senators, things like that. Really excited to have you here. Being right won't win the fight, but there is an argument for everything. So I like to think about policy change in a little different style, that there is an argument for everything. So to Kayla's point, there's somebody that's going to be moved by a story. Tell my story to anybody that will listen, and move to every person that I can. And I think continuing to do that is truly what will remind people that these are human issues, that these are their neighbors, their friends, their families. Those are really important moves to happen, especially among people that are somewhere in that like movable middle. What I think about for the people that don't necessarily care if I live or die, I start to think about, what is it going to cost? What does the trans ban actually cost? Let me tell you. Okay, so all of our fiscal conservatives on the line, the trans ban seems like it's going to save us money. Oh my gosh, we spent $9,000 per service member over the last 10 years. Oh my gosh. We spent the same or less money than we've spent on Viagra in a single year on all 10 years of transgender affirming care. That's very expensive. Well, guess what the price tag on the trans ban is going to be over the course of how much it takes to actually remove these people, to pay out their benefits, to pay out whatever court cases they're going to have to battle between now and the end of this, to replace, to retrain, so you can't even put a value on time alone, but you're talking about billions of dollars. Let's go back to the American taxpayers today and tell them the trans ban is the policy that will cost you $2 billion. You were complaining about the half of a penny that you were paying for somebody's gender affirming care. How about if I tell you add 200 times that? You're not paying $2 to get them out of the military. And then on the other side of it, you're going to be paying for the crisis interventions, for mental health, for medical care. Because guess what? When you don't get preventive care, you then end up in the emergency room, which costs more. When you need mental health treatment, but you can't get it because your provider keeps calling you the opposite sex pronouns, you end up going and you end up trying to die by suicide and end up needing interventions in a longer term care facility. You literally look at the cost stack up over and over and over again to bad policy. That is the business case for why you should do this. There's an argument that wins everybody, and even the most hateful people that are conservative and maybe just don't believe that people like me deserve rights. At some point, this will cost you far more than it ever cost you to begin with, and maybe that will be that. So I think one of the things about being a policy advocate for people like me right now is really learning really well how to move people, or what is the lever of change that's going to move that person, and starting to push in that way. There is an argument that's not all rights-based, even though that's always my go-to, because I think that right and wrong matter somewhere. But that's not everybody. And recognizing that that is the truth and that is the reality, and working within that and finding that argument that will win. Because if you really truly are a fiscal conservative, this is going to cost you hundreds of times more than it ever would have for you to let the people that want to keep you safe keep you safe.
Yeah, that's amen. So the floor is now open for questions. We're going to start with one from a state senator from Massachusetts. Love to see people from the Bay State. In Massachusetts, there's a Veterans Equity Review Board created to help soldiers separated under Don't Ask, Don't Tell, which helps service members correct separation records and regain access to benefits. Is something like that something that could help trans veterans separated under the upcoming policies? Lindsay, go ahead.
I'll hop in here because so trans service members are, in theory, entitled to an honorable discharge. There is not supposed to be the same code that there was for Don't Ask, Don't Tell survivors. So the problem becomes that they're separating them in a similar way. So there's not going to be a specific, like I was separated in the military and I wasn't given veteran status, because in theory, assuming that, implementation is, I don't know what it looks like, but the theory is that everybody will be given, as long as there aren't mitigating circumstances, an honorable discharge. So the problem that won't necessarily be in discharge status, unless you see what we saw in Don't Ask, Don't Tell, which is people using other ways to get people out, getting them in trouble, sexual assault, like there's different ways of pushing people out of the military, which served under Don't Ask, Don't Tell, you know how this goes. So there is a good possibility you might still see people criminalized, but not penalized in the same way. What I will say is that one of the things that's really alarming about what's happening with the separation process is what's called a separation code. And so you actually see, this is not necessarily, and this is where the state land lives a little bit different, is that you don't always have a separation code for a state level benefit, so you won't necessarily need to correct it. But there is a JDK code that's going for officers that are getting pushed out of the military, and it's a threat to national security. They're basically being put in a category that they're a threat to the national defense of our country, and put in a category of people who have gone AWOL and release national security threats, like really wild stuff. that would prevent them or preclude them from potential employment in the government sector, in the defense sector, getting a security clearance. So those are the things that I think are going to be more pressing in the beginning while we're trying to figure out how the discharge process actually happens. So I think we need a little bit more information about how that JDK code is going to be used and what that's going to mean for the long-term outcomes for people. What I will say, if you're in the state of Virginia, it's probably an important conversation because the defense industry is so heavily located in the Virginia area to be really thinking about where people separating out of that would traditionally go into the defense sector that are no longer going to be allowed to because they can't get a security clearance. So thinking through, are there programs that you can do to sponsor security clearances for people? Could you do different things to allow for people to be able to access whatever disparities that come from those codes to be able to create programs for that? So I wish I could say that this would be a simple process because we've already done this with Don't Ask, Don't Tell, but they got creative and did it a little different this time. So we still have to figure out what does it look like in implementation. And to Kayla's point earlier on was we actually still don't know when people are going to start getting pushed out. So voluntary separation, some people have been pushed out, not that many. More people are sitting in a boat of the government shutdown. Guess what the government shutdown meant? Not being able to fund travel and exit orders and process paperwork and get people out of the military. So all of these people who have been on admin leave since May, waiting for their decision, are now being told that January is when we'll restart the voluntary separation. So you have this whole category of people that are getting ready for involuntary separation that are waiting till could be the end of next year.
Speaking of a waste of taxpayer dollars, leaving people sitting on admin leave for months and months and months, doing nothing, but still getting paid until they stop getting paid. One thing I do want to mention as a potential avenue for those equity review boards, and Senator Edwards, thank you so much for bringing that up. It's a really a great point for folks who haven't thought about it for LGB service members, is can that review board waive time and service requirements that may exist for eligibility for some of those benefits. So if you have any benefits at the state level that say like, oh, you're eligible for this if you served at least 24 months, 36 months in service, if somebody is kicked out because they're trans without having met that service requirement, could this board say, we're going to waive that and allow you to become immediately eligible? So that is an area where even though this is, a different process to push people out, there still could be an avenue to find ways to support. The other thing that I want to mention in response to that is that one thing that I love, Luke, that you shared with me is that you expect and hope for this toolkit to be a living document and for folks to be able to provide feedback on what's working or maybe what hasn't worked as well in their state. And so as folks are trying out these policies or trying something new, share that information back to Luke, and this toolkit can be updated with, here's an example of what worked where we are. Here's some data on how it worked out. Here's specific language that we were able to pass through the legislature. So there are great recommendations that are currently in there about here's what's worked in various states. There could be new things that come out of this that we don't know about yet. There could be great examples out there that are in the middle of being implemented today. So make sure that as you implement these and other ideas, things that are already working, get that information back to Out in National Security so that the toolkit can be updated so that it can be kept alive and relevant into the future with new ideas, with new solutions that folks can build and grow out to continue to serve those who need the help.
Thank you so much, Kayla. That's a great point. And for those of you who want to see it, it is up on the website. They've just posted the link in the chat again. And we're very lucky to have a dedicated research team that pulled together examples for almost every policy solution we sought from different states. With that, I'm going to move along to our next question. Someone has asked whether or not we've considered state military justice codes and whether or not we could include transgender protections in those state laws. That's something I don't know anything about. If you guys have thoughts, go for it. If not, we're going to have to move along to something else. Yes, this is the wonder of federalism, friends.
My vague understanding is that when it comes, that federal supremacy,
I would assume it's federal supremacy, right?
Yeah. I've know folks in, say, California that in National Guard that They may not want to abide by this, but it's happening anyway.
Oh yeah, no, I'm sure in many states there are people who would rather not, for the same reason that, the National Guard isn't really a reservoir for folks, because if it gets activated under Title X, trans members of the Guard will get kicked out. Right, Lindsay?
Yeah, there was a question in there about whether veterans can serve in their National Guard instead, and the answer is not as simply as you think. Under the last trans ban, there was a move by several state governors to say that their state would continue to include trans service members, even if federal policy changes. I do believe that Washington State has done a great job of knowing exactly who their trans service members are in their National Guard. It's many. I would encourage all states to kind of think about how do I identify and make sure that I can keep them safe as long as possible. But as far as a long-term solution, it's not a great solution right now, considering that many state guards people are getting called up and activated because of the nonsense that's happening across the country of deployment of National Guards into cities like my own, and just really looking at that's not a viable solution when you have to, when they're being forced to put together task forces to do rapid action and rapid federalization. So I wish that it would be a simple solution, but I will encourage people to really be thinking about what is the long-term stability here. It is not simply about making sure that one person can go from the American military to, Australia or New Zealand's military. It's not about making sure that they can go from being a veteran, getting pushed out of the military into the National Guard. When I think about what we want to be doing in this moment, this is not a 1-year problem. This is not a 2-year problem. Hell, I don't even know if this is a 4-year problem. We're really looking at a long time of battling policy. That's not just whether or not you can serve. It's can you get health care? If you are discriminated against, will you get justice? If somebody abuses you, discriminates you, violates you, will anybody care? I think about the actual impacts of military service in this moment and long term on the trans community. It cannot just be about this one moment in time, making sure we can keep wearing the uniform. I, as a trans person, am really thinking about what is the long-term stability and likelihood people like me make it out of this moment. And do I want to push people from one harmful system to another, or do I want to create better systems and solutions that can be more than a Band-Aid right now? So I think of the National Guard as a Band-Aid. There are some people that will wholeheartedly want to pursue it because that's who we are. We are servants at the end of the day. But as far as what we should be encouraging people to do, I truly want to be thinking about the long-term impacts and health and whether or not we live or die, whether or not we experience extreme mental health crisis, as the result of trying to go and maintain this. I just really think about the longer, bigger wraparound of, yes, I can technically go from one to the other, but will I lose my job again in 6 months? And what will that then do to my mental health after I've already been hurt really badly by this Department of Defense? So I think fine-tuning what do we actually want to accomplish in this moment and not just what can we do, because that really does, the measure of success is important to me, is what are the actual outcomes of our community and the trans population, because 1 in 5 of us, no matter what terrible policy they put in front of us before all of this was said and done, 20% of us would serve in the military. We're going to keep doing that. I know that because that is who we are. Can we continue to make sure that we survive service, that we have equitable outcomes after service, and that trans people don't have to choose service as the only outcome or viable pathway to economic stability like myself?
Yeah, that's...
Can I?
Go ahead.
Please go ahead, Luke.
Oh, no, I didn't have anything. You go ahead, Kayla.
I saw another question that was posted that I wanted to jump to really briefly, in part as a bridge to something else for folks to think about. There was a question, what states are going to be potentially most affected by this? So the states that have the most active duty personnel as of today, as far as I can tell, are California, Virginia, Texas, North Carolina, Florida, and then Georgia, Washington, Hawaii, South Carolina, Colorado. So when we think about what this means, let's also consider that some of these states are not going to be interested in this toolkit. And so what can the rest of us, whether that's potentially at the state level, but also importantly at the nonprofit level, do to help folks in states that are not going to have any interest in helping and supporting them if they are kicked out for being transgender, move to a state that is more likely to have policies in place to help them rebuild their lives.
That's a great answer. And I'll get a little, the answer to your question is a little bit wonky in the sense that people enter the military from one place, separate from the military from one place, and then choose where they go after service from another place. And not all of that is it's all convoluted for a regular person. And so really trying to pinpoint what are the states that will be most impacted. I'll actually flip your question again, much like I did with Luke's, is how do we attract those communities to our state? I think it's the better question to really think about is that much like there are programs that are intended to states of like Texas and Florida and all of the states with the highest veteran concentration to bring in benefits like property tax, things that the extra GI Bills, things like that attract people. So what I will say is you, in some ways, being the state most impacted means that people thought you were safe enough to return to. So if you were the person with most people decided to settle in the state of Maryland after service because it was the safest place, that's a badge of success, y'all. That people thought the state of Maryland, the state of Washington, the state of Illinois were all places that they could go. If you want to receive thousands of incredibly qualified people to your state and local areas, start thinking about how to attract them now, because I'm not from a place of everybody talks about how bad things are for our whole community, and they are very bad. But when you're hemorrhaging $50 million pilots and the tuba player from the Navy band, literally, these are really I employ the tuba player from the Navy band that it happens to be trans and it happens to also be getting kicked out. The tuba player is the joke around here. But think about high quality talent and to Kayla's point, civically engaged people with an incredibly diverse talent background that have incredible skills that can be added to your communities. Think through, how can I be the state most impacted because I brought all those people to my state? We talked about that we say Maryland because I did actually at one point say to the Director of Veterans Affairs that you want to be the home of the trans community that's being purged as a challenge. And I hope that you all take that as a challenge too. We want to be the epicenter of where people, just like the Castro district in San Francisco was built by World War II, that's purged from the military. Where is that next Castro district? Where is that next gay purge? Where is that? Because we are in the era, where is going to be our home so that we have one?
That's a great point. And I think, ideally, if things work well, these folks should still get one final military move that will pay for their moving expenses to get them to a safer state. I'm also thinking about folks who got out before this, who I know who are stuck and in bad places. And so, what are ways that we can help folks who were pushed out, who left the military for any reason, who are trans veterans already, and what can we do to support them as well? So thanks for clarifying that I was conflating two separate issues.
Mm-hmm. Teamwork makes the dream work. But going back to Lindsay's utilitarian point, as we sort of close out here, even if you compiled all three pillars and did everything recommended, it would only cost the state $100,000, $200,000 a year to reach this population, which is, a lot of money, but also not a lot of money, given that you're going to attract, people who were logistics officers and cybersecurity experts and helicopter pilots and other things. And also just as a matter of human decency. Yes, the tuba player. Let's not forget the tuba player or the welder or the plumber's assistant or the plumber's mate. There we go. That's the right term. I think we will end on one last question, unless you guys just want to do closing statements. One of the folks has asked where there's safe and accessible housing for trans vets. Are there wraparound services that also support a trauma-based approach? And is I'll tell
you that we run a program, and our program is very centered on healing. They're with us for 12 to 18 months, and the whole program has got a case manager. They each have a case manager that's does financial assistance, gets them collected and connected employment, does housing meetings, things like that. So at least our model has been that way. That I don't know who else you would have to ask because there are no others. But you could probably ask like people that do trans-specific housing and not specific trans veterans. But for me, when we built our model, it was very much built on the practice of healing. And that community house is a home and a place where people can spend time and heal from what they've experienced and have wraparound services. We also have a community center that we commingle the programming to try to get them engaged in the community and different things. So the answer is yes, and it works because people don't feel like they're just living in an apartment by themselves and that they don't have anything to, kind of look forward to. We even have a house cat. Her name is Wish. She's fantastic. Yeah.
All right. Well, that sounds like a model that folks should look up and maybe replicate in their local city, county, or neighborhood. I want to thank both of you so much for your time. I'm trying to end on time here. I hope everyone on the call today learned something from our wonderful panelists and has taken out the opportunity to review the toolkit and will maybe print it out and take it to their mayor or their governor in the next couple of weeks. And if you have other questions, you can email us at info@outinnationalsecurity.org. Thanks so much, everyone, and enjoy your afternoon.